All right, so this is my story, and instead of it being all played out, there's a couple of points I really want to address, of course. So I'll try to do my best to do that. But why did I even end up in dental? I left about 7 years ago, maybe eight now, almost. But I was working for a family friend, and I just didn't see there was enough money in it. I saw the writing on the wall, and I didn't really want to compete with the current office manager to become the office manager. They had been really happy, and I could have. I could have taken what I'd known and just gotten another office manager job at the time. But it just wasn't fun, to be honest. Being in dentistry, especially the way most dental offices run it, it's not fun. And I understand why, just why the suicide rate is so high, or at least why they say so in dentistry is because if you work your entire life and you don't get properly paid for it, which you see that's one of the biggest things that I like to talk about, it's not just because of the money. Money is really important, but it's not everything, right? It's up there with oxygen. And for me, my story is I came back into dentistry because I got a call when I was actually traveling through China. I was on a trip through South Korea and China, which again, on my last trip when I did that, I had learned some very interesting insights. And it's always great to travel out of country and visit other cultures to see the way that they do things, and to see the way they respond or they live life, because it's very revealing to see that there's not only one way to do things, and in fact, there's a lot of wisdom and things that we can learn from these other cultures. So for me, I was in China. I get a call, and it's the worst phone call that anybody should get. Right? I wasn't even 30 at the time. I get a phone call, and my cousin says that my dad had passed. It shocked me. It it threw me for a loop, and there was just an overwhelming amount of feelings that had happened at that time when I found out, because it was very sudden. And he was I asked what happened. He was in the middle of a hike. He was carrying the bag of lunch, the lunches for the rest of the hikers, and it was a church outing. They go on this weekly trip where they go hiking, and mid hike, mid stride, as he was taking a step, they say it was a undiagnosed heart disease, but his heart just stopped beating and he collapsed and he died before he hit the ground. They flew helicopters out. Um, they took him to the hospital, and that's when I must have gotten the call. There wasn't enough time for me to fly back, and even if I had been there in California, by the time I had gotten the call, it was too late. There was nothing that we can do. So curious, I wanted to find out what it was, because just 1 week before, or like a week and a half before, he was telling me that his doctors just gave him a green light and he was going to be able to start coming off all of his medications, because he had been struggling with, and he had been taking medication for high blood pressure, high cholesterol, and diabetes. Diabetes being the worst one, I guess. And for him, he had gotten that under control. He was starting to get a good consistency in his blood sugar, and the other ones were just not as much of a concern anymore either. He actually didn't need to be taking those other medications for the last like year or two, because, and I'll share, but why it had gotten to that. But for the past, I think it was about 3 or 4 years. Yeah, it was almost 4 years before he had passed. We had known about his diabetes, but it was type 2. But I also know that diabetes, well, I didn't know when we first heard about it, but I know now, and I think everybody knows now. But diabetes type 2 is a completely lifestyle driven disease. So meaning we cause it. The choices that we make create diabetes, and if we make different choices, the diabetes goes away. Um, for my dad, uh, the thing is we just didn't know what we know now, and that's why I want to share my story, because it wasn't the heart disease. They say that for not just my dad, right? There's like 3 million deaths, so that makes it out to about 2.2 million deaths a year. And they say that it is heart disease, breast cancer, or some kind of disease in the body. But what they don't talk about is the mouth or hidden infections, like infections in the jaw, infections in the tooth, in the root, all in the mouth, because we use this word dental, right, in our for-profit system to ignore the mouth. And sometimes people even confuse dental with the mouth, which it's not. Dental is just the tooth. It only has to deal with the tooth, the whole tooth, and nothing but the tooth. But anyway, back to the story. So I had lost my father. We had done lifestyle changes, and we'll get into like what those lifestyle changes are and what you need to do in an actual like video, because I don't want to. If I get stuck on any one topic, I've done so much research and there's so many experiences that I could share. I don't want this to just drag out to something that's not useful. But I want to share with you that it was a very tough time for me, because when I was helping my dad with diabetes, I didn't know this one thing, that I know now. And it is the most important thing, because everybody focuses on the science, or everybody focuses on the data. And the data is good. But even the problem with data itself, I found through my story and my lessons, is knowing where it comes from and why it's there in the first place, to know how to make sense of it. And so what I mean is, for my dad, they did an autopsy and there was this whole like 60-page report. But I had a very unusual feeling and thought, basically. As I was reading this report, I can tell the doctors did not know what killed him. They said it was undiagnosed heart disease. I mean, how can you just have a disease in the heart that just all of a sudden popped up there when all of the other markers in the body were good? And he was being seen by doctors in the US and doctors in Korea. Like, if that wasn't the case, I may have bought it. And I think that's what they just hope, is not nobody asking questions. But upon looking into it further, I found out that undiagnosed heart disease or breast cancer, all of these things, it's pretty much the largest killers in our society today, right? That in disease and healthcare. And so when I looked at those numbers and I saw that, there was a direct link I found later. I read a book. And so in searching through this, what happened, actually, I'll go in order, is I was angry, I was frustrated, I got the coroner's report. And so then I shared it with a couple of my doctor's friends. I was very fortunate to work with some alternative doctors. Like, my cousin is a ER doctor in University of Southern California, Irvine, or not Irvine, University of Southern California in LA. I went to the UCI. I went there not for pre-med, but for undergrad, and I was going to go to pre-med. But all of that I decided not to do, because I wanted to practice. I couldn't say it back then so clearly, but I wanted to practice health and not medicine. There's a difference. Medicine is literally, by definition, synthetic. It's a synthetic drug or treatment. And also, by definition, that means anything that is a medicine is something that probably is not the best solution for our health. I mean, medicines are great in war, or if we get torn apart, or if we're in a car accident and we need to get our blood pressure stable. Great. Medicine and drugs are great. But in almost every other situation, there is a better solution. Not just healthier, but less side effects. But again, that's for a different video. So for my dad, I share it with these doctors, and I'm hearing back. There's a couple of guesses. They're saying, okay, maybe the diabetes medicine with the blood pressure medicine, and then he had, had some habits of drinking. So he had been, especially, going to Korea, he was drinking, and then he would take over-the-counter Prilosec, which is a heartburn medication. So we thought, oh, maybe it was, the connection of those. Maybe it was the over-the-counter drug mixed with these two or three other drugs. And that became, for a while, something that I considered. Then, all of a sudden, a book. All of a sudden, a book on my shelf. I had gone through so many books, and it just, sometimes you read things and it just doesn't click and it doesn't make sense. Because I had heard the statistics, like disease starts from the mouth, or 70% of all heart disease and all breast cancer starts from the mouth. But it didn't click until I was thinking about my dad, undiagnosed heart disease, never caught it, so it couldn't have started from the heart. Where could it really have started from? And then my mom says one day, as I'm looking at a book, she says, "Oh yeah, did you know that your dad, it wasn't just the jaw pain, your dad also had root canals that he was complaining about." Then it was just, at that moment, it was just like a flash. And it was a realization that I had had. And for me, it was so shocking that nobody else had had this realization. And if they did, we just don't talk about it enough, because it's the one thing that we cannot ignore in our healthcare system. So if 70% of all heart disease and breast cancer starts from the mouth, but 90% of all disease has a common source or link from the mouth, how is it that we even call it health insurance? By forgetting the mouth, right? Or said it another way, in every other part of our body, that health insurance is great, because if we have infection, we cut it out, right? We remove it with malice. But in our mouth, we use the word, oh, it's dental. Or we use that word as a reason or excuse to not cover or treat the most important part of our body. And because dental is great for teeth, but dentists are the only ones that can work in the mouth. Okay, so if this is confusing or I'm losing you, I used to try to say that they didn't do this on purpose, like the people that created it, but of course they did. The insurance companies did it to make money, to take as much money and to pay as little back. But I will go one point further to say, now we know what that is. All we have to do is demand and ask for what we've been promised. And in healthcare's case, you can't have a healthy body without a healthy mouth. So any health coverage is not even health coverage if it doesn't cover your mouth. Forget dental. I'm not talking about whitening, but including the teeth, they should be, because now we do know they are living parts and connected to our brain and the rest of our nervous system. They do have nerves right there in the teeth. So these are living extensions of our brain, and they're not just chewing apparatuses or chewing tools. All right, so when it comes to my dad, we had thought for a while that it was, maybe just these drug interactions, maybe he just had an overdose, maybe, that just stopped his heart. But then we looked at, okay, so he had two root canals. He had infection or pain in the mouth that he had talked about on and off for about 3 years. But my dad had such a high pain tolerance. I mean, literally, it's a kind of guy that he'd break his foot and he would still be walking on it. So ignoring pain isn't a bad thing. I mean, isn't a good thing, by the way. I know especially a lot of guys, gals, we do that. Especially we focus on, like, our kids, if you have kids, more so than ourselves. But if you feel pain, especially anywhere in the mouth, pay attention to it. And root canal too. Again, just very quickly, I'm going to keep it short with the root canal. There's so much stuff that I've learned about a root canal. It's probably the worst thing that you could ever have inside your mouth. And if you have a dentist that, all they do is root canals, they're called endodontists. Great. You just have to know the story and where it came from. So I'll just share like root canals are not all bad. If you want to keep your tooth, and in the past, that you didn't want to have a missing tooth, and the quality of your smile was a very big determining factor of status, right? It was a status symbol. So they asked dentists to keep their teeth at all cost, even if it meant just drilling the root or the infected part out and stuffing it with, disinfectant, or, it's not bleach, but something like bleach to disinfect it, and, stuff it with plastics. And they deemed it good. Well, the problem with the root canal is they found out that they took that infected tooth or out of a person, the root canal, and they put it in the back of an ear of a rabbit. And I think they did this about 30 times. All 30 rabbits died. And I'm not saying that rabbits are the same as humans. Of course, we know that's not the case. But what I am saying is, if it killed 100% of the animals because of a toxic infection, like this happens in animals and this happens in humans. When we leave infection in the body and it's left to spread, and it festers and it gets worse and worse and worse, it's like sludging up the system, and then sepsis happens. It's like uncontrollable infection, and your body just hangs. Your heart just stops beating because there's just too much infection just flowing in your body, right? Just because you have the infection that starts in your mouth, unfortunately, it doesn't just stay in your mouth, right? Like, as you know, like, you don't just get sick in your pinky or your toe. If you get sick, your body, you get sick, right? And it's the same thing. If you have an infection, it might be, it might start in your mouth, and 90% of the chance, or 90% of the time, it does. It makes sense because that's where we have all the wear and tear, the normal use. We eat, breathe, drink, chew, we consume everything through our mouth. So that it just makes sense that that's where we're going to get the damage, and that's where we're going to be the filter. So just like you would if you see like a car filter or any air filter, how you have to change it out all the time in a bad environment. That's really our mouth. But cleanings, scraping off the plaque isn't doing its justice if we treat our mouth like a mechanical part of our body. All right, so my dad's story, when we get back to that, I just have to share that because most people don't know, but he had 2 root canals. I don't know if one or both had failed at that point, because I guess it does matter, but he was already passed away. I wasn't there, and the autopsy had happened. But the point is that the jaw was infected. We know that. And that uncontrollable sepsis is what stopped his heart. Now, this is happening 70% of the time. So we're talking about 2.2 million deaths here in the US. This is not a small number. And this is why health starts from the mouth, and dental is medical. Anytime you go to a doctor, if you have any kind of pain, don't let money be a reason or excuse, and especially not an office manager at a dental office. I'll show some screenshots here and in other videos of office managers, and we're just all people, okay? So I'm an educator. I educate dentists, office managers, and here patients, all the same, to try to better the dental industry. And I'm not always right. So if I ever, can improve, or you have any feedback, I'm open to it. But what I'm trying to say is, the thing that bothers me most is when an office manager denies a patient their dental treatment because they're lazy and they don't know how to take health insurance. And they sometimes they even make patients feel bad about it because they can't afford the patient out of their pocket. How dare you? If any office manager that's working at a dental office is watching this, and goodness, if you're a patient and you've ever got that experience, just don't go to that dental office ever again. This is an easy way that you can tell. If you should ask them if they take Medicare, the medical plan, or any medical insurances. And at the very least, if they don't take it, they shouldn't be proud that this is a dental office and we don't take medical. Because that's a very it's a very easy sign and a red flag to know that if that's how they're going to treat you at the beginning of the visit, it's not going to get any better. And remember, when some of these dental treatments, they do turn into surgery. They literally, sometimes you don't get pass out. Some patients pass out. Sometimes you get knocked out, right? Sometimes patients choose sedation. So if you're going to be put under and even put asleep, you have to go to a dental office or a practice with people that you can trust. And from my recommendation, having worked in not just the dental side, but the medical side and others, work with someone that you like and you trust, right? And it goes without saying, but too many times, bad dental, stories, they can be avoided very easily by just that. Okay, so my dad had that situation. He fell, he had the hiking, and then I have some family friends that connected me to a friend of mine that was doing dental. And I didn't want to do dental. I didn't see that there was enough money in it, but I knew that she was doing incredibly well. Her name was Mila, and I traveled. I was in Nevada at the time, but I traveled back to meet Mila. So when I had met Mila, the first words out of her mouth was, "Dentistry is dead." And I had hoped that I had heard her wrong because I had just come to listen to a dental presentation, or at least that's what I thought it was. She was working in the dental industry and she wanted me to work with her. And then she proceeded to explain herself, but she said, "The future is oral health care." And I said, "Oh, thank goodness. Okay, so it's just, semantics, a play on words." But as I heard the story more, I realized it wasn't a play on words. Dentistry really is dead. The old way of doing it, the conventional way of doing it. So much has changed in technology and healthcare. I mean, if we treated somebody today in a hospital like we did 20 or 30 years ago, it would almost be, I mean, it wouldn't just be OSHA, HIPAA, like every agency would come after you. You would probably get in trouble, right? Like they used to sell snake oil, and this was like 100 years ago. But yeah, if you treated somebody like you did 100 years ago now, it just wouldn't work, right? So in the same way, dentistry has advanced so much. There's technology, techniques, and resources available. Dentists, they mean well, but sometimes the technology and techniques are just so outdated. And even if clinically, most dentists can't keep up with the work, so you'll get the dental work done okay, but the office managers, goodness, talk about just being busy or ego. And I get it because I used to be one. Sometimes you're just overwhelmed. But in most cases, it's a little bit beyond that. And it just happens. So in a dental office, having been an office manager myself, I know that you just don't want to let that ever be the situation why you get turned away for your health. So for me, when I got to Kim and she told me about this opportunity, I had to think about it a lot because she had begun to share how she was doing a medical billing program, sharing and helping other dentists do what she was able to do in her office. For me, when I was in Las Vegas, the reason why it made sense is because at this point I had met Dr. Keith, which was one of the top alternative doctors in the world. He does functional medicine, alternative. He does food allergy therapies and holistic psychiatry. So while most other surgeons were focused on cutting things out of the body, and he studied just the same, he got all of the accreditations in the Royal College of England or Royal College of Medicine in England. And so he went to school in Europe, and he actually got recognized because he made medico-legal history, right? Medical and legal history by proving in court how a food allergy can cause uh, health issues. And then I met another doctor also as a result of this that helped me to understand that there was vitamins or vitamins in the body, which we all know, but just a vitamin deficiency or a vitamin surplus will prevent or speed up the recovery of diseases, especially virus diseases, right? And so we've all heard that oranges cured scurvy on the ships, but as a scientific point, we never really applied it in practice. As at least here in the United States, they banned high dose vitamin C supplementation. But this doctor has the science for it, Dr. Thomas Levy, and he actually stopped being a cardiologist because he saw that 70% of all heart disease starts from the mouth, and 90% of all of the rest of the diseases start from the mouth. And so why is it 70 in the heart if they all, like 90, start from here? It's because just like fluid dynamics, if anything spreads, this is the area everything passes by and most of it lands here. So if you literally were to just like put a drop of something and track it as it circulated through your body, 70% of the time it would land in your heart. I think it was like 30% of the time, 25 or 30, it lands in the head. And then like 15 to 20, it lands in the hips and the other areas. And that's not exactly, but very closely resembling the frequency of cancers. So it all starts from the mouth. Okay, no doctor's going to tell you this because they're stuck in a microscope and they're so focused on the specialization of things. No policy person is going to tell you this because no doctor's talking about it and they trust all the doctors and researchers. I'm telling you this because I've read about it, researched it, I've checked with doctors, and nobody just backed up, looked at this information and took one step back and said, okay, how could we do this better? And that's all I've been doing for the last year or last 5 years, is just working on how we can make this better, and we can. The best part about all of this is that so after my dad's story, we found out that not just 70%, but like every 90% or more of all disease starts from the mouth. So if we can use the mouth not just as the leading indicator and predictor of health, but also maybe use is not the right word, but facilitate, support, and promote the health of our mouth being the number one fundamental and primary thing, because it is. It has the best short-term, long-term, and medium-term indicators of health, and even to the point where like they're doing saliva testing now, where they're able to tell us so much about our not just our saliva, but the quality of our digestion and how prone we are to cavities and even other diseases based on the saliva and the bacteria and the viruses that we have in it. And for example, like our tongue, the way it's shaped, the way it's designed, and the way it looks all means something. So also, if it's dry, or if it's more moist than it, or if there's more mucus than there should be, there's conditions in the mouth that will tell us what's going on with the other systems and other organs in our body, and vice versa. So that's why the mouth is such a treasure trove and wealth of information that, when ignored and when not collaborated and shared, like all this information, which most dentists don't even look for, but when dentists are trained to look for this stuff, some are. You want to go to a biologic dentist or a dentist that doesn't treat teeth like chewing apparatuses, but that are interconnected to your brain, and they're extensions of your brain. So if you go to the right dentist, and if you want to find one, by the way, we have a pre-dental check that you should be able to go to on the bottom of the screen, or I'll have a link somewhere that you can check that out. And you can find a doctor or a dentist that is a dentist doctor, not just a dentist and not just a doctor. You want a dentist doctor in most cases. So again, that's kind of how I got here to start this whole mission called Health Starts from the Mouth. We have done medical billing for dentists for quite some time, and it wasn't as easy as I thought it was going to be in the beginning, because we were making dentists a lot more money than they were used to making. But I didn't realize how many other issues there were. I won't share, just for privacy and business reasons, just to be professional about it. I don't need to share all of the things that we've learned, but what I will say is that medical billing isn't just about the money. And I knew that since the beginning, but when doctors and dentists use it only for cash flow and money, that's when it becomes a problem. Okay, and now we're doing this health starts from mouth movement. So everything that we've done for dentists and dental offices, we're now able to help patients with. So meaning if you have Medicare, you have that red, white, and blue card, or if you'd like to get help finding the right dentist or getting your health planned, check out predentalcheck.com. It's a resource that anybody can get dental help 24/7 without having to actually visit a dental office. And in most cases, as we know, going to a dental office, they usually sell you on their treatment or their dentist and what they know only. And the big problem with that is you may not need what they want. And this isn't just, like tasting a new water or tasting a new bag of chips. This is sometimes, if especially if they recommend surgery or a filling or a cavity and then another dentist decides that they don't see the same thing, it's probably good that you got a second opinion. So pre-dental check, that's going to be such a lifesaver, and if not at least a tooth saver for so many people, and that's what it's designed to be. I hope my story shared a little bit more about where I'm coming from, why I continue to do this mission. I've done this for the last 5 years, and I continue to look for good dentists, and we do. We have a lot of good dentists on board, and there's some great ones that are going to move forward with our mission. But I've got to say, dentists aren't going to solve this problem. And I was hoping it was going to be somebody else but me, but I guess it might as well be me. So I'm going to be signing off on this video, but I recommend you to join the Health Starts from Mouth movement. Join our groups. We're going to have, I think, a Facebook group or some group where you can kind of interact with other patients to get help, to get insights, and to share, what's worked for you. But at the end of the day, we want to help you be healthier, and being healthier starts from the mouth. So see you on the next video.